Hi, Dr. Franklin. Today I'm going to show you the gastrocnemius muscle length test and another one later, but we'll get to that. I have my patient here, Cam, in prone. I am going to find subtalar neutral. So I'm going to palpate the subtalar joint just anterior to the malleoli, kind of invert and evert, just to find midline there, right about there. All right, Cam, so when I tell you, I'd like you to bring your toes up toward your nose.
Okay.
And go for it. I'm gonna keep him subtalar midline as he's doing this, right there. Can you hold that for me?
Mm-hmm.
So I'm gonna line up the goniometer and test his ankle dorsiflexion. The axis of rotation of the goni is going to be his lateral malleolus. Proximal arm is going to be lateral midline of the fibula, pointing up toward fibular head and lateral epicondyle of the femur. And then distal arm is going to be parallel with the fifth metatarsals. And that is just about parallel. Go ahead and relax, Cam. So that is 88 degrees of dorsiflexion. Now, Cam, I'm gonna bend your knee up here. So we have his knee in 90 degrees of flexion now. He's still prone. And I'm gonna measure dorsiflexion in this position as well. So, same landmarks. Thanks, Cam. Keep bringing those toes up. Okay, and this is 84 degrees. So what we're looking for here is a difference of greater than 7 degrees, which is indicative of gastrocnemius tightness. Dr. Franklin coming back at you with another video for subtalar inversion. So we're gonna test Cam's, this is a manual muscle test for Cam's tibialis posterior, which is innervated by tibial nerve and roots L4 and L5. So Cam, what we're gonna do is I'm gonna have you point your foot down and in for me. First, we'll just kind of go through the range of motion. Any pain with that?
Nope, all good.
Perfect. So this time I'm going to apply pressure opposing that. So I'm going to bring your foot up toward your nose and out. Just resist as best you can.
Got it.
So I'm going to stabilize his mid tibia, the anterior portion, and then my pressure is going to be his medial aspect of his foot. All right, Cam, so go ahead and point your toes down and in, and hold, hold, hold. Good, nice. So that was a 5. If he couldn't hold against resistance, we'd go gravity eliminated position, which is still supine, and I'm just going to be looking for his range of motion going down and in and palpating tibialis posterior tendon, which runs just distal to the medial malleolus. So Cam, go ahead and point your toes down and in again. And here we can see tibialis posterior right there. So that would be at least a 2. One would be barely palpable contraction, and then 0 would be no contraction at all.